Pathology and what you need to know. Yeah. So what is pathology? Just look at this terminology. All of us know logos is to study. So here we have another term, pathology. So pathos means suffering. So it's a Greek term. It's a scientific study of structure and function of the body in disease. So you're going to learn about the disease process. So for example, you see somebody who comes to you with cough and expectoration. That is bringing out a lot of sputum and fever. How do you treat that patient? Isn't it enough if you just learn pharmacology, the drugs? No. You need to know what has caused. That is etiology. What has caused this cough and expectoration of fever, and what changes have happened in the particular organ. And if you learn pathology now, this is a continuous process. As is your pathology, so is your medicine recipe. This forms the basis of the disease. For you to be the best clinician, you need to understand pathology. Same thing you're going to learn again and again in medicine, OBG, surgery, wherever you go. Don't say I learn pathology here, forget and go. So keep this knowledge forever. So even your clinical subjects you can very easily answer. Nice tree. How many of you have seen apple tree? Yeah, only North Indians. None of you have seen apple tree. This is an apple tree, you have seen? Good. So this is an apple tree, right? Yes? What looks very nice in this? Apples. The two red apples are so nice. Nothing else looks nice? Yeah? Baby at the bottom, yeah. If you carefully see, that looks nice. Okay. Why only apples look nice to you? Colorful? Very nice, right? Very tasty. You eat it, we don't eat leaves or stem or whatever of that. Okay? But we forget what has given rise to that apple. Yes? So this is exactly, I've just taken this analogy to tell you how medicine has varying branches. And what looks so fascinating to you? Which branch? I'm sure you know the different branches of medicine, or at least you have seen them, clinicians and whatever, other people working. So what has fascinated you? Have you just dreamt of becoming something? Yeah? What? Surgeon? Becoming a surgeon? Then? Yeah? Cardiology, yeah, cardiologist. Then? Yeah? General physician. Then? Yeah? Cardiothoracic surgeon. Then? Yeah? Gynecologist. Then? All these are clinical branches, right? So this is exactly the same. When you're looking at the tree, what looks very nice is the beautiful apples. Yeah? So none of us think the other branches or whatever, because that is what we know. So all these are clinical sciences. All of you, none of you said, you have been in first year for 1 year, and none of you said, I want to become a professor of anatomy, so professor of biochemistry, professor of physiology, or I want to become a teacher, whatever. I'm sure you've gone to some labs for investigations also. Maybe you've not met a pathologist or a biochemist or microbiologist and say, none of you. What looks to everybody, even for the patients, is, hey, they look at the surgeon. They don't look at the anesthetist who is behind, So everybody wants something that is very nice. These are clinical subjects. But then you also said, there's a baby which looks so nice. So this is like, the basic sciences which are there, which you have studied now, your preclinical branches and all that. So your medicine is everywhere, it is interconnected, it is multidisciplinary. So every knowledge, at each phase is very, very important for us. We can't forget whatever we have learned. And what is this? So is it just enough you have the roots and all that, and you put a lot of manure and water the plant and all that, and can it just give you or bear fruits, these trees? No, there should be a communication. There should be something that transfers all this. So pathology is like this. So we don't say totally we are non-clinical or paraclinical or totally clinical. So this is a branch which connects both. Many of you are from Karnataka. I think you understand if I just tell you this. Urige bandoru neerige baralva. Your hospital may have 1,000 outpatients. all these 1,000 people, they're divided. There may be 100 from medicine, 150 from surgery, whatever. But all these 1,000 patients have to come to pathology for investigation. So that is the advantage. So we know how many are there, what interesting cases are there in surgery, what is interesting in medicine, what is interesting in cardiology, everywhere. Pathology looks after the blood bank also. So this is like the stem that connects or supplies the nutrients from for the tree, from your soil and whatever it is. So as is your pathology, so is your medicine. All subjects are important. You may wonder, oh, pharmacologist, your pharmacology professor also told you that pharmacology is very important. It is the number one and all that. We all are important. Okay, this I said William Osler's quote. So it forms the basis of the disease. So dis-ease, all of us know this word. That is discomfort. You're not at ease. It is dis-ease. So then you wonder what to do in pathology. Quite vast. Many people who join, who take up empty pathology, they understand so much is there to learn, because your gynecologist may learn only OBG, your uterus and everything about that. So somebody else, a chest physician may know only about lungs and all that. So but here in pathology and then there in medicine and to a certain extent radiology, we need to know everything. The entire body and entire disease process has to be learned. So you need to know, buy some books. Have you bought some books? So if your seniors have Robbins, basic pathology, you may take it from them, or if you want to buy, I still remember few students who were really, insisting that they have to read Robbins. What was his name? That fair guy who used to come to you also, who is reading Robbins and thin, after the 2 years, So it is, yes, it's become slightly a reference book. So you may take another book that is Hirsch Mohan, have one textbook. So you need to read from that book. So reading repeatedly, it gives you a photographic memory of what is in that page also. When you are sitting and writing exams also, you know that, oh, first paragraph is this and the picture is here, how you can have all that. So by Hirsch Mohan. Then there's a practical book also by Hirsch Mohan. There are 2 books you need to buy. How many of you have bought? How many of you want to buy? I want everybody to buy. If your seniors are giving it, it's okay, take it from them. And those who want to buy, you may just contact Deepthi. You can give your name. She would get it with a good discount also. You need not go to the city to buy it. So you may just give any class representative here? No. Okay. We need to have a class rep, I think, for your batch. So you may just give the list of names of students who want to buy these books, and Deepthi is in charge of society and she could get it to you with whatever, 25% or whatever is a discount. Keep a name list to her. So then hematology, I have chosen the right PPT. It is April who chose this, He's helped me. Anyway, hematology and all that, what we teach, and clinical pathology also, that is enough. So pathology has branches. So what are these branches? One is surgical pathology, where we deal with the gross pathology, macro pathology. Okay. So then what else you have learned in anatomy? You have learned histology. Histology deals with the normal structure of the organ. So here we look at the deviations. Now you have learned histology, that what was normal. So we look at what is abnormal. So it is histopathology. Histopathology. So macroscopy, microscopy. Macroscopy is what is visible to the naked eye. Microscopy is what we see through the microscope. Okay. So histopathology is one. And cytology. What is cytology? Study of cells. Yes. So how do we study the cells? So we take the cells from the body. Either it is the fluid that is collected at various sites that is removed and sent, or by artificial exfoliation. So we may scrape and take a cells for cytology, or we may put a needle and then aspirate the cells for cytology. Okay, cytology deals with study of cells. So then we study hematology. So you have learned hematology, the basic physiology. So here it is hematopathology, but still we call it as hematology. So that's also a branch of pathology. So important for you is histopathology or surgical pathology, which has macro, micro, then hematology, cytology, and one more thing. So you are starting with clinical pathology first. What is clinical pathology? Study of, what did you do in biochemistry? What exercises and practicals? Urine analysis and all that, no? Then, apart from urine analysis? Okay. So we don't deal with serum and blood, estimation of whatever this chemical constituents there. So clinical pathology has, of course, urine analysis, very important. So now you start interpreting. There you might have learned a test to detect glucose or proteins. But now here you do continue with detection as one part. So that is a skill. So next is knowledge. So if glucose is present in the urine, we call it as glycosuria, what has happened to the patient? So you start analyzing, you start giving that interpretation here. Then hematology, you've done certain exercises here. You look at what is abnormal. If you've seen a normal peripheral smear there, now you study in detail anemias. So if you have done WBC count there, normal. So now here you study leukocytosis, leukemias. So all these disease processes. So you have one practical per week. The practical day for them is Friday 2 to 5. So practical hall is here we have 2. So one is downstairs and the other upstairs. I think next class we may just take them round the department once. Okay. So for practicals, anyway, first class we tell you what you need to bring in on that. So buy practical records from the society. It's available in the society. So your apron, nameplates, the color pencils. In addition to HNE, so you get this orange or red color pencil, your ordinary graphite pencil and all that. Don't say you are now in third year and what fascinates you is your step around the neck. But don't forget to get all this. You're moving around in the hospital with the patients and all that, but when you come to the practicals, you need to get all this. Okay, so next class is, when do we have the next class? Tomorrow. Have you seen that anybody who has the timetable with you? You want only girls to be very active. Ladies first. No? Why don't you people vocalize, verbalize into that? Yeah? Saturday 9 to 10. 8 to 9. Okay, then Thursday afternoon you're with us for tutorial classes. That is from 2 to 4. Don't let us see. One class probably will give you instructions of pathology that will be marked as 2 classes. Don't say Thursday I did not come, I didn't know that there are 2 classes and all that. Thursdays afternoon 2 to 4, there are 2 classes, 2 to 3, 3 to 4. So if you miss Thursday afternoon, you are losing 2 classes, attendance for 2 classes. I hope I made this clear. Don't come back and say, I missed 2 afternoon classes on Thursday and my attendance has come down. You get 2 attendance on Thursday, that is tomorrow. Tomorrow you have in the afternoon. I think we'll start with instructions for practicals. And those of you who have taken the books, please sign there. I consider that as the attendance. Okay? I think 43. He said, okay, 43 are there. I don't know what happened. Yeah. But today's class, he said, yesterday,
47, 42 madam.
43 have come. So let us see who are these 4 people who have absconded. No, our main aim is to pull them and bring them to the class, and also to see that there's 43 remain in all the classes. So don't just keep absconding from the classes. So you will come to know about other teachers as they come and take the classes, or in the practical class I think all of us would come and introduce. Okay? So be happy, you went to your 3rd year. So change whatever, let us look at a shift. How you were and what change needs to be done. Okay? So you should be very enthusiastic, energetic to learn everything, and this should be a very, very easy way for you. So 2nd year you are here, within no time we see you all as final year students. That's how it should be. Okay? Thank you.